So with any of the modalities that we're going to be discussing throughout this entire semester, one of the first things that we're going to be looking at, especially on your lab practicals when we start doing those, is the positioning of the patient. Whether we're treating a shoulder or a hip or a knee, a back, whatever it might be, we always want the patient to be positioned in a position of comfort, but we also need to think about the modality that we're going to be choosing and how it's going to be most effectively applied. So in this situation, if we apply the older diathermy unit, as we discussed a minute ago, the energy travels from one head to the other head. So the patient is positioned comfortably. We're going to be treating his low back today, and he already has a nice kind of a dry fit cotton shirt. Again, if a person has a silk, more of a silky shirt or a shirt with high polyester material in it, so that moisture is not wicked away or absorbed well, then you probably need to apply an additional cotton towel just to kind of make sure that that moisture is taken up. So we'll go ahead and apply that today just because it's good practice. Okay, and so then we're going to bring in the machine and kind of put things in proper position. So as we mentioned before, the energy with this machine flows from one sound head to the other sound head. So if I'm going to be treating low back, I might apply one sound head on this side. The other sound head would be over on your opposite side here. The energy will flow from here into the body tissue and then back out into the other head. And we can control on this machine the rate at which that flows. As we know, electromagnetic energy travels at the speed of light. So if we're going to control the intensity or the amount of energy that is absorbed, we need to control the rate and then the power or the voltage that's applied. So if I'm going to position him here again, we'll bring the machine right around a little bit more here. Okay. Now, as we will discuss further in lecture and in lab, the proximity of these two also makes a difference in the depth of penetration in the tissue. So if these are kept very close together, the depth of penetration will be slightly deeper. If we spread these apart a little bit further, the depth of penetration will be a little bit more superficial through the body tissue. And again, those principles will be discussed a little bit more in lecture, and we'll talk more about this in our lab as well. So at this point, we have the patient comfortably positioned. We have a warm towel, or a towel that will absorb moisture, and we are ready to choose our parameters at this point and initiate treatment.